Marty and I'm giving my speech for cultural diversity. My issue is on barriers and behaviors of Black men that negatively affect their health care. As an RN, sitting in this wonderful conference room of a hospital, healthcare is all around us. Healthcare, many people I work with are just at hospitals every single day, and we feel comfortable coming to the hospital. 1 in 5 Americans have visited an emergency room at least once in their life. 58 countries in the world have universal health care where it's simply not an issue to get health care. Unfortunately, in this country, that's not so yet. And for a group of men, getting health care is just have many barriers. To start off with, there's several issues that affect Black men and their issues to get health care: socioeconomic, masculinity, environmental, and finally, racism. Health care and its challenges for men, Black men especially, they're more prone to certain diseases. Cardiovascular disease is prevalent among Black men more than any other economic or racial group. It is the #1 killer of Black men. They're also, life expectancy is less at 69 years. They're also #1 in leading colon cancer, lung cancer, prostate cancer, and 1.5 times more likely to suffer from hypertension. And those who suffer from hypertension do not get it treated and are not well maintained, which also contributes to their early life expectancy. Their socioeconomic status that prevents them from getting health care. They're one of 3 minorities who have diminished health care cost. Socioeconomically, their jobs are the #1 priority. Many of the jobs that they work do not offer health insurance. And health insurance and socioeconomic status is the most important predictor to adversely affecting someone's health. In this country, we see these men postponing health care, going to the emergency room only when dire situations call them to go to issues that could chronically be maintained, like high blood pressure. We see them only going and seeking health care when pain drives them to this area or it's beyond their control. They'll pass out from strokes or heart attacks and then be taken to health care. Some of the other issues that are socioeconomic include their job status. Many of these workers cannot get off work to go to health care appointments of their primary care. And like I said, only 20% in this country have primary care physicians, and the Black male is in the lowest part of this. And many people working and in the situations they live, they just cannot get the health care that they need and deserve. Masculinity, as I mentioned, is also a factor found in a 2005 study. Many people feel that preserving the image of a strong male dominant figure and seeking health care promotes weakness and shows that they are weak. And then many see that they are the primary providers for their family. So they will sacrifice their own health care in order to take care of their children and wives. Also, unfortunately, fear is a major contributing factor. Many men, not just Black men, are scared of the unknown, scared of what health care brings, scared of testing, scared of the pain involved in testing, blood tests even, my husband included. Environmental factors, not only economics, keep us from seeking health care. Unfortunately, many men in the Black community cannot maintain living situations in middle-class neighborhoods where health care facilities are more prevalent. In inner-city neighborhoods, they are less likely by 1/3 to have local emergency services and doctor's offices available. In facilities where doctor's offices are available, they're in poor working-class neighborhoods that will close early due to environmental issues of gang violence. They also are more likely to live near hazards, such as landfills or bad water supplies, which make their increased risk of cancer more prevalent. Also, drug-infested neighborhoods are a primary cause, as well as gang deaths. Black men are more likely to be shot or knifed, and thus resulting in emergency room visits. As we all know, alcohol and tobacco companies have long targeted the minorities for their promoting of their issues, alcoholism and tobacco use, which also puts them at risk for cardiovascular disease. Unfortunately, the biggest risk in Black men seeking health care is racism. It has long been known that Black men have a distrust of white men, and Black men are more likely to seek out Black doctors. Unfortunately, doctors and Black men entering medical school has decreased in the last decade. Many prejudices still exist, and a mistrust across the board. There's also poor communication in the healthcare community, and clinics in poor neighborhoods, and they find it insufficient funds to treat underinsured men. Poor medical advice and adherence to regimes such as maintaining at-home blood pressure monitoring is also a significant factor in affecting men in their health care. Of course, we also have a study from the Tuskegee Airmen experiment that ran from 1932 to 1972, which was not so long ago. 40 years of negatively affecting black men in their treatment of syphilis. This is a group of men who were treated by only white doctors and were not treated appropriately for syphilis to see the results of syphilis on the brain. Unfortunately, all these have created a massive storm that black men are simply not getting treated. What can we do about it? Fortunately, I didn't know about it. We live in a small town in southern Indiana, and I'd never even considered that black men were not seeking out the treatment. I, of course, knew from years of working experience that black men are more likely to suffer from hypertension and heart attacks, and then we see them for that, but it never occurred to me that they were coming to the emergency room instead of seeking a family doctor. Like many hospitals, our hospital recently had a men's tune-up day that encouraged men to get out and socialize with other men and seek doctors and providers. This needs to become a standard throughout the United States, as well as increase clinics in neighborhoods where men live, increased availability to health care after hours or before hours of work, and of course insurance will always be a major predictor. We need to tackle these issues. They're serious issues, and now they've come to the forefront of my attention. So thanks to this class, I will now begin working on this. Thank you for your time. Thank you, guys.